Welcome to the Compliance Perspectives podcast. I'm Adam Turtletop from the Society of Corporate Compliance and Ethics and Healthcare Compliance Association. Joining us today is New York-based Alex Tyrrell. Alex is Chief Technology Officer, Health for Wolters Kluwer. And today we're going to be talking about shadow AI, an area of AI that is even less familiar than many others are for people. Alex, first, can you tell us what shadow AI is?
Yeah, well, Adam, first of all, thank you for having me. And I agree, it's a really sort of interesting topic. And if I could just, I'll put a little perspective on it, right? So, shadow AI really refers to the use of unauthorized or unmonitored AI tools within organizations. Now, it can happen in any organization, but in particular in healthcare settings and healthcare organizations, the use of these tools they may be intended to improve efficiency, but they can also potentially expose PHI. They can even potentially expose PHI to the open internet. It can create privacy as well as compliance and regulatory risks. And also, they may lead to patient harm, right? If inaccurate information provided by the AI is used in, like, for example, clinical decision making. Yeah, does that kind of help?
Yes, very much so.
So hospitals, provider networks, and other healthcare organizations are increasingly turning, often unknowingly, to unproven sort of general purpose LLMs. Clearly, the intent is to, assist in patient care, clinical decision making, cut down on administrative burden. And their accessibility makes them really, really appealing. They're sort of all on our phones now. We've all used sort of these, open models on the internet, but they sort of function as black boxes, and they're sort of prone to hallucinations. And again, sort of, what I covered before, they may leak or expose PHI.
That's a huge bucket of risks, but at the same time, the genie is really out of the bottle these days. So how do I, if I'm a compliance officer, find out if there is shadow AI being used in my organization?
That's a really good question. So I'll provide just sort of a preamble, a little bit of context here, right? So many organizations actually don't have a clear view of how or when these tools are being used. It can be a real challenge. We recently did a Future Ready Healthcare survey, and we found that only 18% of respondents in our survey reported that their organizations had formal policies around the use of Gen AI in a workplace setting. And only 1 in 5 said that organizations require staff to follow formal training on the technology, right? So, with that context, so what do organizations do? Now, there obviously is an opportunity, for example, for devices that are issued by the organization that are within the perimeter of the IT constructs. It's possible to conduct regular audits on these devices and help detect sort of unauthorized things like browser extensions, desktop apps, and other services, especially those capable of data processing. But let's be honest, I mean, there's still personal devices, there's phones. It's really hard to make sure you've covered all the potential gaps. So another approach really involves sort of gathering feedback from employees, performing surveys, looking for areas where there is the potential use for Gen AI to provide value, and beginning sort of putting around a structured program around where could you safely introduce tools to kind of prevent that whack-a-mole, right, Adam? Like, wouldn't it be easier if people just had a trusted place to go to use some of these tools and technologies, which can absolutely add value, rather than people really not understanding what they should be doing and kind of choosing their own adventure? Yeah.
Yeah, and whack-a-mole is not a good business strategy for most anything. So how should organizations work to govern AI use?
This is also a really interesting question, and obviously a bit of a challenge. One thing that I think most organizations do, they sort of have a sourcing and procurement function where you're using trusted AI tools from vetted sources, right? So prioritize AI tools that leverage expert validated medical content, have transparent decision making processes, and especially avoid any risk or semblance of training models on patient health or information or any other private or sensitive data in the organization. That needs to be clearly stipulated when you're going through the sourcing of procurement, legal, and contract negotiations, and ensure that all the AI tools really go through that formal procurement and due diligence process. That's really, really important. I think another aspect is really to sort of establish that structured governance. Again, going back to the survey results, it's really important that there is a clear plan, well articulated in the organization, how to move forward, make it an organizational wide framework with AI oversight, that kind of basically defines approved usage in which use cases, and it can overall manage and monitor and kind of prevent the introduction of shadow AI into the organization. And I think most importantly, and again, this applies even to my own organization, educate folks. People probably aren't bringing shadow AI into the workplace on purpose, or they may need to be aware that's causing risk. It really is really is an opportunity to both engage and educate, which is really important for people to really understand the risks and understand how you want to sort of reduce shadow AI adoption and what the other alternatives, trusted and verified, would be for staff that want to use these tools. Yeah.
I really like what you said there about engage and educate. Is that the answer for protecting PHI, or is there something else?
Yeah, I mean it's quite a few things, right? So let's start with sort of something, sort of what should be obvious in most healthcare organizations, where PHI is a key to a clinical workflow. For example, when you're working across the EHRs, these ambient listening and scribing technologies, you are likely required by law to maintain certain compliance standards depending on the jurisdiction. It may be HIPAA, GDPR, and also to ensure clear and up-to-date what we call business associate agreements or data processing agreements that they're in place with your vendors. And that's really to ensure you're keeping the entire IT supply chain secure and compliant, right? Now, in addition, in these types of clinical workflows, when you think about the risk of shadow AI, the ramifications and the risk could be quite high. Could cause compliance issues. So some of the other options are key strategies could include, the de-identification of patient data where possible. And again, establishing really that clear AI governance and policies and continuing monitoring AI systems. I think practically organizations should focus on, I think you sort of alluded to it, these trusted and isolated zones. Ensure only the right people, systems, and processes have access to PHI and always verify. It's what we call zero trust, right? Now, practically speaking, sort of the closer you get to the bedside and point of care where things are really happening in real time, there is no room for error there. Your personal devices, use of public LLMs, unmonitored apps, these are dangerous and introduce, also the potential for, providing the right, so the incorrect, medical diagnosis and treatment. And it really just isn't appropriate for use during the patient encounter, if that makes sense.
That makes a ton of sense. Now, as you know, regulations have not kept up with the rapid pace of evolution of AI. How can organizations best prepare for the day when those regulations may come?
Yeah, I mean, so the regulatory landscape is changing and evolving very, very quickly. I'm actually in Colorado. I have a house in Colorado, so I have noticed that it's in the news a lot. The Colorado Artificial Intelligence Act. Other jurisdictions have emerging regulation legislation. There's the EU AI Act. All of these are important to kind of keep an eye on. And so one of the things I think is helpful, and one of the things that we do at Wolters Kluwer is really make sure that the folks that are managing privacy, compliance, legal, they're really right there at the table. It's not an afterthought. We work on concepts like privacy by design. Bake these into your plans and your strategic planning very, very early. So you're really not caught off guard. You're not surprised. You're not trying to play catch up. I think that's really, really important. And also, there's potential to really treat compliance as a strategic advantage, right? Especially when it comes to tools like Shadow AI, which may be free models, or you're really not, you don't really understand sort of the provenance or the source of this information. If you can establish trust and compliance in your offerings, I really feel like it gives you a step ahead of some of these other, offerings that we're starting to emerge everywhere. Yeah.
Staying a step ahead is not so easy these days, given the fast pace of change, but we got to keep trying. Well, Alex, thank you so much for sharing these insights with us today. I want to thank all of you for taking the time to listen. I'm Adam Turtletop from SCCE and HCCA. I hope we're able to expand your compliance perspective.